Thanks. Hi, everyone. I'm so happy to be here. I'm Kristen Schneider. I'm an assistant professor in public health sciences, and I'll talk about a project we have that we employed community engagement. Let me just share my screen. This. You should hopefully see it in presenter view now. Great. Okay, so today I'm going to talk to you about our Central PA Maternal Health Coalition. This coalition was founded in the fall of 2024. So we're almost 2 years in, and it's been a wild ride. It's been really fun. This is the group of us at one of our in-person meetings last fall. And so just to say, this represents a lot of people that you may recognize from Penn State, but also our community members at a variety of different organizations working in the maternal health field. So today, I'm hoping that you can all come away with these following objectives. Identifying strategies for building and sustaining community partnerships, describing how community engaged approaches strengthen trust and stakeholder alignment, applying lessons from our regional maternal health coalition to drive initiatives, and thinking about all of our members as people and how can we be inclusive, but in a feasible way, have people meeting often enough, and finally have a measurable impact on the community. So just a little bit of a background. The Pennsylvania Department of Health funded 4 regional maternal health coalitions. So this maps us out. For some reason, we're all in the eastern part of the state. I think it just happened that way. And it's pretty much well covered, though, the eastern part of the state. We're the only academic or organization that was funded through this mechanism. The other ones were the Maternity Health Coalition, the York Adams Regional one, which is led by the Family Health Council of Central PA, and the Maternal and Family Health Services organization. So we are the Central Pennsylvania Maternal Health Coalition. We were established in fall 2024. We serve these 6 counties. We, at this point, have 23 members representing 16 different organizations. And we have, I didn't mention here, we have patient members as well, or people with lived experience on our coalition. Early on in our coalition work, we created our mission statement and vision statement, which was revised through a focus group with more patients, but generally the theme shown through, maintained the same throughout. But we strive to organize and strengthen our collective efforts to improve healthcare access, foster safe and supportive environments, address social determinants of health, and promote equity in maternal health outcomes. Guided by our mission, our coalition is committed to developing actionable strategies that address the Pennsylvania Maternal Mortality Review Committee's recommendations. And we envision that Central Pennsylvania is where maternal health care is accessible, inclusive, and culturally responsive. I meant to mention that really all 4 of these maternal health coalitions funded by the state are created to look at the Maternal Mortality Review Committee, which is a committee that meets every month and discusses cases of maternal mortality. And they come up with recommendations on how these deaths could have been prevented, because most maternal mortality can be prevented. And so there's a list of recommendations, and they've been meeting for a while, and my understanding is they said these recommendations aren't really being implemented. Let's come up with a mechanism that's the main priority of a coalition. And so that's what we're doing. We're working to implement their recommendations. So we noticed in Pennsylvania, there's a fragmented service landscape, especially in maternal health. There's gaps in coordination across sectors, very limited awareness of available resources at the organization level, the provider level, at the patient level. And there's a lot of social drivers affecting maternal health outcomes. So we wanted to create a sustainable infrastructure to improve maternal health through community engagement and collaboration. When we started meeting, we decided we really want to eliminate silos, because even people coming into our coalition didn't know that these other types of organizations existed. So I think that's been pretty eye-opening for a lot of us. We use the collective impact framework to create the coalition. We have a backbone organization, which is Penn State Health. And we coordinate the logistics, the deliverables, we do the reporting to the state, we get people together, and we have experts in the field meet. Um, we create a shared agenda, and this agenda is grounded in the MMRC recommendations that they've all had access to. We talk about them every month. And we've come up with we use the Smarty method. We've come up with Smarty goals to address these recommendations. We work really hard to keep people engaged. We have a fantastic coalition membership that seem motivated to the same mission. So having that alignment has really helped, and having that shared vision has helped all along. I think, of course, people came in with this similar visions, but throughout we've been working on really narrowing our scope on how are we truly going to implement some of these recommendations and improve maternal health and reduce mortality locally. We've worked on having these standing monthly meetings that people can rely on with the same Zoom link. We've had people say that, which surprised me, but having the same Zoom link made a big difference. So having these kind of small things were I don't know, helpful. We have a repository of resources to keep communication as open as possible. We always have a feedback mechanism after every meeting so they can provide any feedback they may have. And we have diverse membership, which we've already talked about. So we created this big picture together, aligned with what the Department of Health wanted us to complete, which was a gap analysis early on. We selected recommendations from the Maternal Mortality Review Committee, which we felt like we could implement, which are feasible and impactful in our local community. We developed an action plan, and then we're kind of in between this. We've developed the action plan, and we're kind of working to implement and evaluate some of these interventions at this point. And then we plan to disseminate our findings. And our community, one of our coalition members said, we need to have this goal at the bottom, which is to foster collaborative exchange and community engagement, as a reminder for all of us. So we did a bunch of things in our gap analysis, supported by the coalition. We had a patient focus group, which is supported by our cheer group, our CTSI, and we brought in some patients to our coalition. We have had a few different coalition satisfaction surveys to better ensure that all voices are heard and we're aligning with their priorities, and again with feedback. I met with every organization actually on the coalition, and we went through the maternal mortality review recommendations and what are you asking? What are they currently doing in their organization? What are the gaps that they see? And so I think that qualitative data and those interviews really helped engage our community members and also helped me understand more about their own challenges within their own specific organization. So that helped come up with our priority of Smarty goals. Then we had a shorter list of recommendations and aligned goals that we would address, and we've voted on them as a coalition on what we would work on. We also did some quantitative data analysis. We had our own Penn State Health EHR that we looked at. We were provided data from the Pennsylvania Coalition Against Domestic Violence. As it happens, domestic violence actually is its own category in the MMRC recommendations for our 6-county area. So it's a huge cause of maternal death across Pennsylvania, but in our 6 counties, it comes to the top. The 3 main causes of death in our area are domestic violence, suicide, and substance use. So they provided data. PA Navigate provided us data, Vizient and the PRAMS, the Pregnancy Risk Assessment Monitoring System. We worked with the state to get data just on our 6 counties also. So we wanted to better understand some of what was going on. So I'll just show you some of the data. We had data across our 6 counties. This is from our EHR. What we noticed here is just it's not really being reported as a diagnosis code. That was our main takeaway, I think, from our own EHR data. When we looked at mental health and substance use, we could see some counties that may have stronger, like Perry, maybe has more substance use than the other counties. And Perry may have a little bit more depression, although that's kind of similar across counties. These data are from the PRAMS survey. This asked, during your most recent pregnancy, did people This is domestic violence. So we just noticed there's a big racial difference in params for people who were reporting in the param survey. And then we looked at types of health insurance people had. So this was all just to give us a sense of what's going on in our local community. And we were able to provide these data back to the coalition. We just did a check to see, this map shows you areas that are vulnerable, more vulnerable in this is our Penn State health catchment area. But we know that of our 6 counties, just one of the counties is rural. But there's so much diversity within a county, and we just really wanted to capture that and share that back with the coalition for their feedback. Other things we looked at, this is the Vizient Social Determinants of Health. They provided some data on low birth weight and postpartum complications. They have social determinants of health data too, but also health outcome data. And this was the data we were provided from the PA Coalition Against Domestic Violence, which is showing some disconnect between healthcare professionals and domestic violence organizations. So I don't want to talk about this forever, but this is the last piece of data, I think. This is our PA Navigate data. We met with them several times. They're a great new resource available to people in Pennsylvania that can help connect them to resources like PA 211 and Find Help. So they just showed us if people put in pregnancy across our 6 counties, what are the kinds of things they were looking for. So they're just at 96 searches, but you can see the majority of them are housing. So we really could tell that. And I think we know people working in the field that housing is a huge social determinant of health and huge concern for a lot of people in our community, but this sort of solidified that. I wasn't sure where to put in the presentation because this was sort of along the lines of when we were developing what we knew was important. We showed the gap analysis. We had these conversations with our coalition, but at the same time, we were planning to hold an ECHO series. And the ECHO series was meant to do 2 things. One, it was to get feedback from a larger community on what are their priorities in maternal health, what are important topics to them, what are they seeing as their work in the field, working with pregnant and postpartum people. And then we also wanted to provide important information to them. So this was really meant to do both. We were able to we had 600 people register, a little bit more than 100 people. So we were provided a lot of information on what they thought were important areas to look into in maternal health. And also we provided information through 6 sessions, a webinar series on social drivers of health, perinatal mental health, trauma-informed care, maternal mortality, doulas and midwives, and culturally responsive care. In all of our sessions, we had somebody from our coalition present, except maternal mortality, which was presented by the Department of Health, their maternal mortality review committee staff. So I think it was a great start to some of the action steps that we plan to take with our coalition. This just happened last fall. And from that data, from all of our gap analysis, from our monthly meetings, we came up with actually 14, but I didn't need to show them all here. This is just an example of some of the Maternal Mortality Review Committee recommendations that we chose to start to address. So they really have to do with systems concerns and health literacy or information coming out to the community. We came up from our larger recommendations. We came up with these deliverables. These are the deliverables we started working on now or have completed working on. We have a few more too that, we're still going forward with a lot of other things we want to accomplish. But what we started working on right away is developing regional maternal health resources. We just really realized that there are a lot of resources out there for pregnant and postpartum people, but people don't know how to find them, if they're eligible for them, where, all of that. So that was one of our first priorities. And actually, we're working really aligned with PA Navigate, as this is a goal of PA Navigate too. So we're working closely with PA Navigate, especially for sustainability. We created a database with training opportunities. So this was important to the MMRC that there was a bunch of recommendations related to training. And so we had really wonderful medical students who came together to help us did a major scoping review to find all of these trainings. And we brought those back to our coalition and said, what trainings do you think are relevant? Which ones would people want to engage with? Which categories of information do you want to know about each training? They said things like, we need to know the cost, we need to know the time commitment, we need to know, is it in person or not? So we were able to come up with that whole database of trainings, which is now shared with our state level perinatal quality collaborative. So that was a big accomplishment, I think, of our coalition over the last few months. Last spring, we had this wonderful Ask the Experts panel. It was a patient-centered webinar. I say series, but it was 2 webinars. We had one at noon and one in the evening to make sure we could catch, if people would have different availability. And this was also put on through our coalition. So we had 6 coalition members in each of these sessions answer questions from people, and people register. We had over 40 people register, and they asked their questions, and our coalition responded through that. And a lot of them were provided ahead of time, and some were live. And something we're currently now really working on is strengthening referrals between domestic violence and home visiting programs. So these are the resources we came up with as a coalition. They came up with the design. They came up with what was important to include on these resources, documents. And so they're distributing these to their patients now. We just actually finalized this last month. And this is more detailed information on substance use, mental health, and domestic violence, which are the key causes of maternal mortality in our region. This is just a taste of our community resources map. And so that's always going to be updated as we keep learning about resources, which is awesome. So we have it in a Google map so people can look at where they live and get directions there. And it's also in a table format. This is the trainings I've already talked about. So this is categorized by the type of training recommended by the MMRC and how do people access them. This is a screenshot from our Ask the Expert session. So that was a really wonderful experience. We're hoping to hold these again in the fall because we had a lot of interest. And now our domestic violence work is really coming up and running. We have a community relations grant through Penn State. We're working closely with the PA Coalition Against Domestic Violence, and we have some focus groups planned in the summer and also engaging our students. So I think that's hopefully going to have some interesting findings. We can update you all maybe this fall when we complete our focus groups. And so not only is this just, somewhat of a research project, the outcome is planned to be a personalized training for Penn State Health developed through our coalition membership based on what we learned from gaps in why is there some kind of disconnect between our healthcare providers and our local DV, domestic violence agencies. How do we strengthen that? And so we're going to create a training that to just improve that connection. Some other successes we've had, these are just some meetings we've attended or presented at. We're starting to do some tabling to provide those phone number flyers and other resources we've come up with together as a coalition. So we're really excited to keep our momentum going and have just some really amazing dedicated members. So we hope and think our coalition could be a model for replication. We base this on community-informed priorities, cross-sector collaboration, this collective impact framework we've been using for our coalition. Shared learning. We love when people learn things from each other, and we really work to facilitate that in our coalition. We have the backbone organization, which does help, and this resource mapping has been really helpful too, I think, for our coalition members and hopefully the larger community. And I think we've been using the community engagement framework, looking at that arrow you may have all seen about community as advisors, collaborators, equal partners, and leaders. And we've been, I think, at different points in our journey together, have had them in kind of different capacities, and working to keep it going up the arrow as possible and as there as feasible. Some future directions are we hope to continue to build community trust and communication within our coalition and in the larger community. We really want to also be able to provide resources to providers and community organizations, encourage health system engagement at the institutional level. So some of the work we're doing, we feel like we may need to involve more health system leaders, which we haven't yet. And then hopefully we're also developing infrastructure for future research projects. So that's it. Thanks. This is our flyer on our coalition, and then we have these. We have a website, and we are on Instagram, Facebook, and YouTube. So please connect with us. Thanks, everybody.
Thank you, Christine. I think there was a question from Nathaniel. I guess, what was your definition of rurality? Since
Oh,
been
that's a
some
great
changes.
question. That's always a question. I know. Yes, yeah, it was. We used RUCA codes to define rurality. So could that definition increase the number of rural
Actually, there,
counties?
because
Maybe. Yeah, Nate.
actually, RUCA changed in 2023, so you might not have used the most recent definition, and that is why I was asking, because I know that some of the counties were coded, but based on different population values, and if you're using 2013 RUCA codes, you're going to have more rural. Yes, that's my concern, is that you might have to make sure you're including the new definition and not the 2013.
Gotcha. Thanks, Nate. I will look at this link you shared, and I'll look at this and maybe follow up with you.
Actually, I'll send you another link for the.
I appreciate it. Thanks so much.
Thank you. Any other question for anybody else? Well, thank you, Christine, for all that information. That sounds like you've been busy with that whole project this past year.
Thanks. It's been really fun. Thanks for the opportunity to talk.
And next, I think we're going to have Paula, Miriam, and Jess. I don't know of the three of you who's taking the lead to present to talk about some of the community engagement resources that CTSI offers, the work that you've been doing.
Hi, guys. I'm going to start out. So I'll share my screen here. Bar. Okay. So, hi, everyone. Thanks for having us. Dr. Schneider, thank you so much for talking about your research work using community engaged research. That's what we're here to talk about with our community engagement team, and the work that we do with researchers to try to help build community engaged research throughout the Penn State community. So it was really nice to hear about your success, and I was looking at the different names of folks who are joining us today, and we've actually worked with quite a few of you. So you might be hearing about these services that you've already used, but hopefully you'll learn some more things along the way. My name is Jess Schrodel, and I'm joined here today with my two wonderful colleagues, Paula Moody and Miriam Miller. We are the community engagement team again for the Penn State Clinical and Translational Science Institute. So we're with CTSI at the College of Medicine. What we're going to be doing today is just really sharing about the community engagement team, a little bit about our background, how we started, but then really we want to go into the services we offer research teams here at Penn State, as well as some of the different resources we have available. So we'll start out talking about some support services, and then we're going to talk about some community connections with our rural health partners. And finally, we'll end up sharing, we'll end on the note of sharing some resources in the form of toolkits that are available. So as far as what our purpose is, we started the community engagement team in 2021. We didn't really get it moving. We were at the end of 2021, so we really got moving in 2022. But the whole purpose of it is really to bring the voice of communities to Penn State research. And we do that by trying to bridge gaps in research participation. So we know that there's lots of underrepresented populations out there that are not being properly represented in research for a whole bunch of reasons that we'll be talking about. But by hopefully bridging that gap between those participants that are maybe out in rural communities or in marginalized populations, we're able to bring the research into or expand it to broader populations. With that, we hope to reduce health disparities in underserved communities throughout the Commonwealth and ultimately improve wellness in communities that have historically been not represented well in research. So the support services we're going to be talking about today that the community engagement team provides to our research teams is our educational programming, our individualized recruitment and retention consults, and then Miriam's going to talk about our community engagement studios. So for our educational programming, we started offering programming and sessions, educational sessions back in 2022. They're usually 1-hour sessions, and we try to offer them on a variety of topics. The idea behind them is really to strengthen community engaged research practices amongst our Penn State research teams. We try to make them available to Penn State faculty and staff, of course, but we also really have tried to spread the word with external academic and community partners. And we've been really successful at that. We have a listserv of over 1,500 combined community partners and research faculty and team members. We try to offer guidance and expertise on community engaged research topics with a focus on practical application and partnership. So we're trying to offer skills and resources that it can be used in real world situations. If anyone is interested in looking up our educational sessions that we've done in the past 4 years, you're more than welcome to go to this QR code and you can find our YouTube channel that way. So some more information about our research educational series. This is just some data that we pulled from 2022 to 2025. We've actually done 3 additional sessions in 2026, but we're going to just look at the data from those 3 years of 2022 to 2025. We delivered over 18 sessions, and we've engaged over 2,200 participants. And about 60% of our participants are generally Penn State faculty and staff, and then 40% are community partner and organization participants. We're really excited about the amount of folks who have started kind of following our educational series and sessions. They offer a lot of really good practical application and opportunities for partnerships with the communities. We focus, of course, on community engaged research practices, and we have had topics that have varied from anything from lay dissemination and how important that practice is to working with the unique needs of marginalized populations such as LGBTQIA2S+, veterans, people with neurodivergence. And just today we did one where we were talking about research with older populations and older adults and how important that work is. We do offer usually internal and external guest presenters. So we try to find somebody who represents Penn State and the work they're doing. So today, for example, we did have a wonderful Dr. Vanscoy. She talked about her work at Penn State working with older adults. And then we were able to bring in another speaker, Dr. Ducon from the University of Southern California, who also talked about his research that he does with older adults. So it really is a really lovely opportunity to learn what's happening here at Penn State, but also all over the country. If anyone is interested, oh, I already talked about the QR code. All right, we'll move on here to the annual training focus. So throughout the years, this just kind of lists the different topic areas we've focused on throughout each year. Starting in 2022, we really hit the basics, which were what kind of trainings were available for community partners and researchers. For example, the city certification program is what I'm trying to say. The certification program, which is offered for community partners to really learn the basics about research before they would enter into a partnership with a research team, and also basic grant writing skills. And we continued on, and more recently we've done things focusing on engaging unique populations, as I described before. And then we also have spent a lot of time on inclusive engagement and what that looks like through lay dissemination work. For our retention and recruitment consults, we offer one-on-one individual consults to any research members of research teams or faculty. We have used our expertise to connect folks, researchers, with over 550 community partners over the years. We have a really expansive list, which is really helpful being able to share the work we're doing. We assist research teams with planning community engagement research practices from the very beginning stages of proposal development all the way to the end when it comes to results dissemination. The community engagement team's expertise is really in giving voice to populations that are often underrepresented and under-resourced in research. We view research projects from a lens of equity. So we're always coming from that lens of how can we most make research accessible and meaningful to the communities that we're trying to serve in the first place. With our connections in rural communities and other underserved populations, we do our best to connect research teams with populations that may be difficult to reach. And Paula is actually going to talk about some of the ways we've done that. So she'll be speaking in just a little bit about that. And finally, we strongly encourage research teams to plan ahead for results dissemination strategies for the broader community. We provide evidence-based resources and tutorials for the teams when they're trying to learn that very important step of lay dissemination. And if anybody is interested in meeting with our team on doing a consult, we are available anytime. Consults generally last anywhere from 45 minutes to an hour. We will provide as much as there is a need on behalf of the researcher. We're happy to meet more than once. And if you are interested ever in learning more about our services and what we can do to help, you would just go to this QR code that'll take you to our application form for service. And you would just want to click on recruitment and retention, and that will get you right to us. So thank you everyone so much. I'm now going to turn it over to Miriam Miller, who's going to talk about our community engagement studios.
Thank you, Jess. Just real quick, I'm going to highlight the community engagement studios that are part of our Penn State CTSI Community Engaged Research Corps. And we have other services and activities that we do as well, but this is the one I was asked to share with you today. So our community engagement studio model is a way to make a small group and a big impact. They're structured 90-minute sessions, and it provides a chance to hear directly from community members about feedback on your research project. And they can provide insight onto what you're planning to do. It helps you get some research relevance. It gives you some backing when you're filling out grants and applications to say, hey, I talked with community members or members of this community, and this is what they were saying. And again, this is supported by our Community Engaged Research Corps at CTSI. The nice thing about Community Engagement Studios, because it's not research, there's no IRB required, and there is a relatively low cost. My services as a facilitator are complimentary as part of the CTSI, but we do ask that you compensate your participants in a manner that's reflective of their expertise and learning experience. Next slide, please. So our community engagement studios do have a lot of value in a lot of different ways. And talking earlier, like there are several of you on this call that I have conducted community engagement studios for. And some of them have resulted in great funding opportunities. So that's fabulous. And so again, this just can highlight, studios can strengthen research. They help to identify barriers before you get into them. It helps you to improve patient-centered design. Sometimes it's about getting feedback on flyers or recruitment plans. It is also helping to get that community insight and lived experience. Sometimes the research project idea is one that when you sat and talked to the community members, you realize they're reluctant to participate in. They don't want to be on a tracking device on their phone. They don't want to know where you're going, they are, that you to know where they are. And sometimes that doesn't work so well for the research plan that was in place. It also helps for support funding, and you have additional support for it. It strengthens your grant applications, especially like our PCORI. It also provides authentic engagement. You hear directly from the people that are impacted by your research. And then you have our support and staff and with planning. it doesn't require a huge lift from you. I suggest it's around 4 hours of time prepping, sharing kind of an overview of the study and the questions that you're wanting the community members to weigh in on, meeting with me to make sure we have the flyer the way you want it and some organized. And then we have just the 90-minute studio. And again, I mentioned before, there's no IRB required for the studio itself. And we can go to the next slide. And this is a little busy, but it is a little bit of the process. And I do have a one-pager that I'm happy to share with anyone who would like to get a little more detail about the Community Engagement Studio process. And just like Paula and Jess shared, there is a QR code to request community engagement services through our CTSI research request form. And that's kind of the first step. And we sit down and we talk and find out a little bit more about your project, what you're looking to find out, who you're looking to hear from, and then we can kind of schedule it and move forward. This is my very generous planning of 6 to 10 weeks. We have turned it around a lot faster than that. But again, it kind of depends on what else is going on in both our work world and your work world, how fast we can turn it around, depending on the recruitment requirements and things like that. So we'll identify the community, we'll develop the research, help you develop the research questions. I'll coordinate the logistics and facilitation. And then we ask that you help your team provide the participant compensation, which sometimes, unfortunately, can be the most challenging part. The studio is a 90-minute facilitated session. We ask that someone from the research team is there to give an overview, as well as, and you're welcome to have another research team member there to help with notes and capturing some of that important information that comes about. And then it's up to you to apply that feedback and how it impacts your study design, your materials, etc. So that's just a quick overview, and I'm happy to meet with you in person or in Zoom land to do a studio for your project. I'll hand it over to Paula.
Excuse me. Thank you, Miriam. I'm going to preface this by saying I've had some glitchy stuff going on with my computer today. So if I freeze or something happens, please forgive me. I will try to work through it. But thank you, Jess and Miriam, for sharing your thoughts about our community engagement team activities. My role today is to talk with the group about our rural community partnerships. And the primary one is with our Lion Mobile Clinic. I'll speak to you a little bit about recruitment opportunities with the Lion Mobile Clinic, and then a project that emerged from this particular partnership. And that project is called Dinner Table Talks. Next slide, please. So the Lion Mobile Clinic is exactly as the name suggests. It's a clinic on wheels, and it is an initiative that emerged from Dr. Mike McShane and Dr. Mark Stevens out of University Park. It is a student-led free clinic that provides basic kind of healthcare services to folks in rural areas. And what I mean by that is like screenings, vaccinations. It provides education and visits folks in the areas in which they live, rather than asking those residents to come to a brick and mortar to receive some low-risk healthcare services. It operates on a three-pronged approach: service, education, and research. And what those three prongs mean is service delivery. So Dr. McShane and his staff provide free services to folks in rural communities, as I mentioned, healthcare screenings and vaccinations and things like that. The educational piece relates to the medical students and some of the other students that are really situated in the University Park area. So it's not just medical students, I should clarify that. It's some undergraduate students and nursing students as well. And finally, the research piece, which is where we come into play, and that is providing an opportunity for us to share research opportunities with folks in rural communities when we ride along with Dr. McShane and his team to the various events that they design and attend. So our community engagement team meets weekly with the Lion Mobile Clinic team. We offer consultations in partnership with the Lion Mobile Clinic. Jess and I have worked together with the team to help develop both an internal and external advisory board, and we attend events that they set up in those communities. Next, please. Here are some examples of the types of events that the Lion Mobile Clinic attends. And really, the purpose of this slide is to share with you that they are targeting different communities with which to engage. Target sounds like the wrong word. They want to focus on connecting with different communities in these areas. So you'll see on the slide here an example of these types of things that I'm describing is that not only do they want to work with rural communities, but other pockets of communities within those rural areas. The QR code here on this slide will lead you to the Lion Mobile Clinic website, where it lists a very detailed schedule of events. Summer and the warmer months are very busy for them because there are a lot of events taking place outdoors and festivals and health fairs and all of those types of things. So there are quite a bit of events happening, and I would encourage you to scan that QR code if you're interested. Next, please. Here's a picture of myself and Jess with Dr. McShane. The picture on the left is at Ag Progress Days. So that takes place over a 3-day period. It engages close to 40,000 folks. And the reason why we were there was to share information with rural communities, share information about research and connecting with research at Penn State. Dr. McShane was there to provide health screenings and education. So the top right picture is an example of educational things that are shared with communities. And then the bottom right is just another angle of us at Ag Progress Days. Next, please. So I'll pause there because what's important about the Lion Mobile Clinic as far as us visiting events is we have the ability to bring recruitment flyers with us. And we have done that at different events, whether they're aiming to engage certain populations or not, really just sharing information about how to get in touch with Penn State research teams if they're interested in engaging in research. That can take place through a consultation. Just share the QR code for a CTSI consult request. So we can help you if you're interested in building partnerships with rural communities or sharing your research with those folks in those areas. The last thing I'm going to speak with you about is what we call dinner table talks. This is an initiative that was as a result or that emerged as a result of our partnership with the Lion Mobile Clinic. And what we really wanted to do was to learn directly from community members what their areas of concern are and take that information and ultimately share it with researchers to help build out potential future research projects. So our partnership with the Lion Mobile Clinic led to us building relationships and establishing trustworthiness with folks in communities, and launching this program that we call Dinner Table Talks. Dinner Table Talks is an opportunity for us to literally sit down and share a meal with folks in communities to learn directly from them about what areas of concern they have related to healthcare quality, access, and delivery. So that initiative is still in its infancy. So we bring that up to you because if you have, rural communities that you're looking to engage with, or not necessarily rural, but communities that you're looking to engage with, this might be a model to use. Again, it's just sharing a meal and having an opportunity to chat very casually with folks to learn about their areas of concern and interest. Next, please. Finally, I'll share some resources that you can find on our website, or that's the Penn State CTSI website. So we've developed toolkits for research teams. The first one is the Community Engaged Researcher Toolkit. And the second is the Research Recruitment Toolkit. We have also developed a toolkit for community partners. So if there are community partners who are interested in community engaged research and don't know how to go about it, this is how they can start. These are the associated QR codes, and you can feel free to scan any of those if they are of interest to you. But again, you can find that on our landing page on our website for community engaged research. Next, please.
Thank you, Paul.
Yeah, sorry.
No.
Thanks, Rafi. Just the last little piece of information is just sharing our email here. So if you have questions or comments or thoughts, feedback, we're happy to connect with you through that email. Thank you.
Thank you, Paula, Jess, and Miriam. I did add the link to the page on the chat, so everybody have the link there. And then Natani made a comment, which Jennifer kind of addressed. But if any of you want to read that comment, if anybody want to add anything else to the comment regarding the community engagement studio and making sure that we engage community members as part of research and get feedback from them more than just part of a process. Miriam, you're muted.
I think Jen did a great job answering that, because studios are just one part of the one tool in our toolbox as far as how we engage our community members. And so, like, Kristen's on here, Sarah Horvath was on here earlier. They have both done community engagement studios and have been able to connect with communities and organizations that they didn't have a connection with before. And so that's a great way from those studios, was kind of planting the seed for those larger relationships in the research process. And stakeholder is actually a somewhat controversial term in the whole community engagement realm too. So it's all about making them value community partners, and that's why we compensate them as well as we do. And again, it's just a touch point. It's not the answer, but it's not a long term, but it is another tool in the toolbox to continue that relationship moving forward.
And I think what Paula mentioned, being out in the community, right, with the mobile clinic is a good way to really engage with a lot of different people out and about.
Right. And the other, we didn't talk about it when we do a community, tomorrow is our community driven research day, where we're going to connect with community members from 3 different counties and kind of lift up community driven initiatives and talk about how they could maybe be translated to other communities as well. So there's lots of different ways that we can help make those connections and have them be longer term relationships.
Well, thank you, everybody. Any other questions or comment? We have like 7 minutes left for this affiliates quarterly meeting. Jess, you have a comment?
Yeah. Well, I just saw in the chat that Nate Geyer,
Yep.
he had mentioned that people with severe disabilities are underutilized in research. And he talks about that. And I just wanted to let you know, we actually did one of our educational sessions specifically on people with disabilities. So if you're interested in watching that YouTube, you can just go to our YouTube channel and the QR code that we shared earlier in the presentation, or you're welcome just to reach out to us and we'll send you the link. And if you have any other comments or want to discuss that any further, we'd be happy to do so. I'm going to
Yeah. Yeah.
Oh, sorry.
Can you put the QR code, I mean, or the link to the YouTube channel?
Yeah, let me try to find that real quick.
I'll also mention that the presenter for that particular session is someone that we connect with regularly, and she's out of the multi-clinical research trials office at Brigham and Women's in Boston. So I can connect you with her, Nate, if that's of interest to you. She's very passionate about that work, and the work, what I mean is making sure that there's representation of folks with disabilities in the research process throughout the entire research cycle. So not just as participants, but also helping design research studies, feedback, engagement studios, all of those things.
And Christine, somebody's asking if you can share the slides, if you see that comment on the chat.
Sure, thanks.
I think we have 5 minutes left. Any other comments or at the cure card for the YouTube channel? Anybody want to go there? Make sure that I get it. Otherwise, we appreciate everybody's time today to be here today, present about the different resources and the work we're doing out there in community and community engagement. I appreciate your time. Thank you. I was having problems trying to get in. I don't know, it happened every single time, but I finally got in somehow. So I appreciate again your time for being here this afternoon. And we'll be back in the fall semester with more of this quarterly city affiliated programs meetings. And until then, have a great summer, and I will see you in the fall. Thank
Thank
you.
you.
Thank you for the opportunity.
Thank you.